So please, for panelists, make sure you mute yourself.
Please make sure you mute yourself.
Okay.
And I know a couple of the panelists just joined us. Welcome everyone who is joining us as an attendee. For the panelists who just joined us, I believe you have sent us your slides, and so we will be controlling those when it's your time to present. So you just let us know when you want us to move on to the next.
All right, so this is today's agenda. Carrie, I don't know if you have any thing that you want to say or welcome everybody before we get started and get moving.
We're ready to start.
Yep.
Okay, great. Okay. Welcome to the Delaware Continuum of Care membership meeting. Happy New Year. My name is Carrie Casey. I work for Newcastle County Division of Community Development and Housing. It is just, really quickly, just welcoming everyone, any new folks that have joined us. We have really been able to rise, I think, to the occasion of holding these really informative Zoom information and presentations on really relevant things that are happening in our state. So I thank the Housing Alliance Delaware folks for helping put this together, organizing these meetings, as well as the CoC board members and membership. So as we enter this new year, I know 2020 was a difficult year. We've all been impacted, personally by COVID, and maybe have folks that we know who have been sick or even passed away from COVID-19. And as we enter into this new year, and we have a new president coming today, no matter how you feel about it, it's always a good way to think of new beginnings, and also look back and reflect and honor those that we might have lost, or that it's been a really rough year with 400,000 people in the United States passing away from COVID. It's just been a year that last year was a year we never would have imagined, but we've gotten through it, and now we are going to look forward. And the one thing, and I think I've said this, I remember in March when we had our first meeting, and was how our agencies and how our members and how individuals have stepped up to really serve those in our state who are most vulnerable, and how those needs of those most vulnerable were very much an issue before COVID, but maybe the opportunity of the attention of how COVID impacts those that are most vulnerable maybe will make real change in our state. So that's really all that I was going to say, and just thank everybody for attending, and looking forward to a really great meeting. And again, thanks to everyone for all the work that you've done to help those in our state as we navigate through this unbelievably challenging time in our state and country. So thank you.
Okay, so the first thing that we're going to go through today is CoC business. There's just a few things under that we wanted to let you guys know about. The first one is CoC governance. The CoC has contracted with Diana T. Myers and Associates to provide technical assistance to update the CoC charter and the MOUs. The MOUs are what delegate the CoC, CI, and CMIS lead agencies and the responsibilities for functioning for that. So we're very excited to be working with them to make some much needed updates to both the charter and the MOUs. The second thing would be funding. With the most recently passed appropriations bill, HUD was authorized to complete a non-competitive auto renewal process for all of the fiscal year 20 renewal grants. So those are all of our CoC grants that will be expiring in 2021 that would have been renewed in this most recent competition. They haven't released any more guidance on that as of yet, but they said it will be coming in the coming weeks. So as soon as we know more and what that process is going to entail, we will be reaching out to all of our CoC funded agencies. And then for the fiscal year 20 competition, we did go through with evaluating and ranking the projects. That was approved by non-conflicted CoC board members on November 10th of 2020. That public posting of all of the scores and ranking for the renewal projects is listed on our website, and you can access it through that link. And finally, there's just some upcoming events. The 2021 Point in Time count is coming up. It's next Wednesday, January 27th. This year, we will only be completing a sheltered count due to safety and some other concerns with COVID-19. So we have been working with all of our partners who do shelter, hotel, motel, and all of those things to make sure that we are counting all of the individuals who are sheltered this year. The 2021 housing inventory count is also coming up. We do not have a deadline set yet as when we're going to be getting that information out to people and requesting it back, but we will be working on that going forward. And finally, we are partnering with the Community Legal Aid Society to do a fair housing training. That is going to be Wednesday, February 3rd from 3 to 5 p.m. I've included the Zoom link to the webinar here. We will also be sending out a separate invite, but that will be geared towards any case managers who are working with clients who are dealing with fair housing issues, and also providers who are required to meet fair housing standards as a part of their service provision. So really anybody who is interested is welcome to attend, and we encourage everybody to attend. So that is it for CoC business. And after that, we will be moving into our next presentation, which is our SOAR presentation with Abigail Kirkman.
Hi, everyone. Thanks so much for coming on and for the opportunity to present today. So like Erin said, my name is Abby Kirkman, and I am the Assistant Director of the SAMHSA SOAR Technical Assistance Center. The SOAR TA Center is a national organization based out of upstate New York, but I have served as the liaison to the state of Delaware as well as many other states for a number of years, and I've been with the SOAR TA Center now for about 8.5. So have a lot of knowledge of implementing SOAR in various communities, and have been working with your SOAR state team leads for a number of years now to advance SOAR in Delaware. I see a couple names that I recognize on the attendee list. So hello, I'm happy to see you guys again. And then, so for many of you, this may kind of be a brief review, but my goal here today is to just have a brief introduction to SOAR, and know that we hope that this will be a start of a conversation, and that we want you to reach out to us if you are interested in learning more about how SOAR can impact your continuum or your community. So I don't know if people could just kind of put in the chat, or, you know, raise your hand, like, what is your familiarity with SOAR? Are you pretty familiar with it? Are you brand new to the process? What is your general familiarity with it? Oh, thank you. All right, so passing familiarity, great. Thank you. Yeah, so I want to provide just a brief overview of the process, and then talk about the SOAR online course at its core. But know that SOAR is so much more than an online course, and that we understand that funding is an issue, community implementation, getting all the stakeholders together. So we really, again, hope that this can just be a start. So SOAR stands for SSI, SSDI, Outreach, Access, and Recovery. And it is a model or a method of assisting eligible adults and children who are experiencing or at risk of homelessness and have a severe and persistent mental or physical health disability, which often co-occurs, and helping them applying for Social Security disability benefits. So SSI or SSDI, what we know so many of our vulnerable populations that we see every day with the work we do, they need these benefits. So SOAR is a process that helps people get timely access to Social Security disability benefits. What we know is that when people have Social Security disability benefits, whether it is SSI or SSDI, it can facilitate access to healthcare and housing. It provides increased educational employment opportunities, and it decreases adverse outcomes. So in 2020, we just finished our results for our outcomes for this. We had close to about 6,500 initial decisions. And we have an average approval rate of 65% in approximately 115 days. Now that 115 days is a little higher due to COVID-19. In the past, we've been around 90, 95, and 100. But with the pandemic, we understand decisions are taking a little longer. We also recognize that we have top 10 states that have a 78% approval rate on initial application in an average of 115 days. And it's not just the approval rates that I want to share with you. We also have a general reimbursement rate for general assistance of about $3,000, a Medicaid average reimbursement rate of about $10,000. And on average, when someone is approved for benefits, they can get a back payment of about $7,000. So you might be saying, well, why, are these numbers important, and why is this impressive? So I'm sure all of you know that getting access to Social Security disability benefits is really challenging. You have probably heard that you need to be denied 3 times in order to be approved. You always have to go to appeals, and that's not the case. And with SOAR, we know that that's not the case. On average, a lay person, if they go in and apply for benefits, the likelihood that they will be approved is about 30%, about 29. If someone is experiencing or at risk of homelessness and they have a severe and persistent mental or physical health disability and they go in and apply for benefits, the likelihood they're going to be approved is about 10 to 15%. So no wonder people get denied. With SOAR, though, you can really see that we are able to get people on benefits quickly, and they are able to move on and move on with their lives. They're able to become stable, and our agency is able to help additional people. So next slide, please. So at its core, SOAR is an online course. It is a process, it is a methodology that is trained through the SOAR online course. We have 2 of them. We have one for adults and one for children. And if your agency would like to become involved and able to provide SOAR services and complete SOAR applications, your caseworkers, they would become trained via the SOAR online course. It is a standardized training. So I know that everything that's being trained in Delaware is the same as being trained in California. And it comes with 20 free CEUs through NASW for each course. It is also free, web-based, open to the public, and self-guided. And what makes it stand apart from other SOAR online courses is that there is a practice case component. And this is why it takes 20 hours to complete, because you will actually go through and apply for Social Security disability benefits for a mock applicant, and then that is sent to the SOAR TA Center to review. Next slide. But what we don't want you to do is just say, this sounds great. We really want all of our staff to be trained, because we know that that is not necessarily the most productive way to implement SOAR. SOAR is a time commitment. You cannot do good applications quickly. And we estimate each SOAR application takes between 20 to 40 hours over the course of 60 days. And many of you are probably like, I don't have that type of time. My caseworkers don't have that type of time. And that is completely understandable. But I want you to think about it in terms of what are you already doing that is similar to SOAR work? So are you already engaging with the applicant? Are you already helping them and documenting their functioning? And then additionally, how much time are you spending with the applicant? Would it be advantageous for you to spend these 20 to 40 hours on the front end in order to get them benefits and potentially move into housing? Or do you want to work with them for a year or two while they're in appeals or they're unable to get these benefits? I'll also say that the time commitment will vary based on whether or not you have easy access to the applicant. So 20 hours may be if they're living in permanent supportive housing, great at making appointments. 40 maybe if you're doing outreach to them on the street or they're not great at making appointments. So this is a document, and I'll go ahead and put it in the chat box once I'm finished, that really talks about how the commitment associated with SOAR. So it's not, like I said, it's not necessarily always advantageous for everyone to become trained, but instead maybe you train 1 or 2 people at your agency, and then they will become SOAR experts, and maybe people can refer to them. This all being said, this will be a great point of reference when we talk later, and hopefully we can learn more about your agency and how this can fit in. Next slide. All right, so just briefly too, we run an online application tracking system. So once you are doing SOAR applications, you will have access to this. And what we want you to do is track decisions. So decisions are, was it approved? Was it denied? How long did it take? There is no personally identifiable information. And it is not as if this is kind of an HMIS, like a beast of a system where it takes time to enter all your outcomes. It only takes about 3 to 5 minutes. But know too that this is very, I can't require it because I don't fund you, but we want to show the great work that you guys are doing. So outcomes tracking is a piece of that. Next slide. And then on this, I just have some additional resources, SOAR overview, getting involved with SOAR, SOAR outcomes, how to implement it locally, and then the SOAR online courses catalog. And if you just want to flip to our contact information. So kind of my parting words before I take time for questions. That was incredibly brief. SOAR is so much more. Currently in the state of Delaware, we do not have much SOAR activity. We are looking to grow SOAR. We've got 1 or 2 case workers who are doing SOAR for their individual agencies, but that does not an initiative make. So we want to see SOAR spread far and wide. We want it to be successful in Delaware, like it is in other states where they have embedded SOAR case managers within the community, within the agencies, and then eventually have funded positions that are dedicated to this initiative. So my kind of request and challenge to you guys would be to look internally within your agency. When someone is in need of Social Security disability benefits, you are working with someone who needs them. What do you do? Do you send them down to Social Security? Do you work with them internally? Do you refer them out? And how is that going? Do you have a 65 to 78% approval rate in about an average of 3 months? Is that your turnaround? And if not, I want to talk to you. Terry, Paula, myself, we want to talk to you, and we want to make sure that you guys can become invested in the SOAR process and potentially bring it to your agency. I'm also very sorry that it says Colorado SOAR liaison. I am indeed the liaison to the state of Colorado. I did a very similar CoC presentation to them a couple weeks ago, and I used their slides. So apologies for that and that oversight. All right, so I hope that was the very brief overview, and I'd be happy to take any questions if you have them. If not, you have my contact information and can always reach out after the fact. I'm just looking over the chat. I don't see any just yet.
Okay, I do not see any messages in the chat as of yet. We will have a little bit of time at the end in case any pop up, but we are going to move on. We were going to have a conversation with Jillian Austin in regards to the vaccine prioritization for those in congregate sheltering situations. It does not look like she's been able to join us yet. So we are going to go ahead and move on. And if she hops on, we'll just go back. So that takes us to our legislative update. So Rachel, if you want to go ahead and take it away.
Sure. Thank you, Erin. And thank you, Abigail, for that presentation. So I will be very brief here. We wanted to just make folks on the CoC aware of things happening locally related to housing and homelessness. So legislative session here in Delaware will be virtual through at least January, and sessions, hearings will be held Tuesday, Wednesday, and Thursday of each week. Both the House and Senate here in Delaware have committees dedicated to addressing housing issues, which is very exciting. In the House, it's the Housing and Community Affairs Committee, and in the Senate, the Housing Committee. And the members of those committees are listed here. Many legislative bills that may be of interest to continuum of care members or folks interested in housing have not yet been filed, but there is a lot of interest in this issue, and we will be keeping the CoC updated as things come along this legislative session here in Delaware. Erin, you can go to the next slide. So I have a couple listed here that may be of interest to folks on this call. I'm not going to go through them in any detail. The presentation will be posted on the Housing Alliance Delaware website. So this will be available for your reference. HB 57, 58, and 60 may be of interest to folks who are interested in housing and homelessness issues and legislative issues. Next slide, Erin. So a couple of major legislative events coming up on January 26th. Governor Carney will be giving his State of the State address, and on the 28th, he will be giving his FY22 budget address. You can go ahead to the next slide. So I think this year creates some really significant opportunities, both at the state and federal levels, for folks to advocate on behalf of themselves or the folks that they serve who are experiencing housing instability, insecurity, and or homelessness. As you all know, the Biden administration begins today, and President Biden has already called for an extension to the federal eviction moratorium through September of 2021. $30 billion in additional emergency rental and utility assistance, another round of stimulus checks, and $5 billion to address the health and housing needs specifically of people experiencing homelessness. So at the federal level, as well as I already said, at the local level here in Delaware, housing and homeless issues are getting a lot of much needed attention. And we expect to see legislation addressing these issues coming up in short order this year. And that's it for me. I'm going to go ahead and we have John Whitelaw joining us here, the Advocacy Director from Community Legal Aid. So John, I'm going to pass it to you, and we were discussing what's happening around evictions in Delaware as you have the last few meetings. Thank you so much, as well as some of Class C's efforts around right to counsel.
Sure, I'd be happy to talk about both of those. Do I have the next 3 hours? Is that good? So let's go through the eviction stuff first. Some of these will be really quick. This is just, I suspect most of you know who Class C is. This is just a little blurb about who we are and what we do. For those of you who don't, we are a statewide program, and we do help and represent folks throughout the state, and we engage in policy work as well. Next slide. I'd put this slide up for another presentation. I think it's important. I think folks often who aren't involved in this business don't understand how complicated evictions are. They are messy. They can be messy. There's a lot of both state and federal law. And I wanted to put it up so that folks could see that there's just a whole interlocking area of rules and regulations and courts. As Rachel mentioned, there is probably going to be an extension of the federal eviction moratorium. I will note, however, that is not a universal moratorium. The one that expired at the end of December, essentially, is only for cases where tenants certify that the COVID pandemic has affected their income. So evictions that aren't about back rent are still proceeding. And we'll talk a little bit about that. So while we are not having an overwhelming volume of evictions, eviction court is open, people are getting evicted, there are cases going on. Next slide. This is just a list of the provisions that are applying. We have the most recent emergency declaration, which sort of added it allowed evictions to occur, but only if they are in the interests of justice, which is just a new standard. JP Court has an administrative order that it put out to say how it was going to handle these cases. They've put out some guidance on what the interests of justice is. And then generally speaking, there are the JP Court rules on how eviction cases are handled. I think everyone on this call knows all eviction cases in landlord-tenant go through JP Court, and that's the only place you can go. That is the only arena where evictions are handled for landlord-tenant and manufactured housing communities as well. Next slide. New processes. There is a pre-trial conference and this online dispute resolution and alternative dispute resolution followed largely by video trials. I do want to give JP Court credit. They have stopped doing the calendar call. So there is no longer a calendar call where everyone huddles together in the courtroom and breathes all over each other. That is not happening. And they are proceeding to handle cases in a careful and cautious manner in light of the pandemic. And then they are trying to get as many cases as they possibly can resolved through an online and mediation process. The difficulty there, which we'll get to in a minute, is it's very hard to engage folks. And so a lot of those cases are just not getting engagement from either landlords and especially tenants. Next slide, please. Now, this slide should be up in, there should be like little blaring things coming down. There should be stars attached to this. This is the game. And I don't mean in the play sense. I say this every time I talk about this. The biggest significant problem in terms of causing eviction problems in the pandemic was the loss of money from the economy. Tens of thousands of Delawareans lost their jobs or have not been able to find work subsequent. So there is all of this income that went out of the economy. And the key to avoiding an additional crisis on top of the ordinary eviction crisis that we've always had is money. The package that was passed right over the new year has allocated a minimum amount to each state. And for the very small states, of which Delaware is one, it's $200 million. $200 million is a lot of money. And even if the state pessimistically only spends half of it, that $100 million is far more money than this state has ever seen to provide tenant assistance. So this is the single biggest opportunity for us to avert evictions. And DHAP, which was the Housing Assistance Program, they had a program was in existence, money went out, but their total then was 20 to 30 million, and now they're looking at $200 million. It is a different game. DHAP is in the process of coming up with a program to spend this money in a way that's appropriate and responsible, and they're taking input from stakeholders. We're giving input, other organizations are giving input. This is the single most important piece, and as the next weeks and months go on, we will see how it gets implemented. We're just not there yet. Next slide. Numbers. Let's go to the very bottom number, because I think that's the most significant. Typically in a month in Newcastle County, there were between 900 and 1,000 cases filed. In December, there were only 400 cases. And I know 400 cases is a lot, but it is less than half of the pre-pandemic volume. So while evictions are still an issue, the number of filings has dropped dramatically since the moratorium started. One of the reasons I will suggest this is happening is because it is taking so long to get to court. Landlords are thinking of more creative ways to try to resolve these cases. We have not heard that they have resulted to self-help, other than like a few terrible anecdotal stories. We don't think that landlords are wholesale violating the law. We think, however, they are looking to work these cases out, and the vast majority of them, we believe, involve money. But the key here is we're not even at half the pre-pandemic volume. So we are not at the current time facing an eviction crisis. I don't think that means we should be relaxed, because we are going to face one, but we're not there yet. Next slide. Landlords are supposed to provide contact information for tenants. It's an issue. It's hard. That's not happening. The single biggest thing that has, I believe, contributed to the non-explosion of eviction cases is the fourth bullet point. There is a significant time delay between filing and trialing in JP court, and I don't mean weeks. I mean months. I have trials in March for cases that were filed in the fall. So it is taking 4 to 8 months to get to trial. And that has really slowed down the process and has encouraged both parties to try to reach a settlement. But there are, cases are happening, just on a much slower basis. If we can go to the next slide. So, we're thinking about how to attempt to solve some of these problems, both in times of the pandemic and globally. Money, big picture money to address the lack of safe, affordable housing and address the loss of income caused by the pandemic. Even once we get through the pandemic, I don't think, again, I suspect I'm just articulating what almost everybody on this call understands fine and well. There is a huge lack of safe, affordable housing for low to moderate income Delawareans. And even once we solve the pandemic, that problem will still exist. Representation matters. We are currently working with a team of advocates and stakeholders to look to engage some form of representation for tenants in cases, and I will tell you that it changes results. When tenants have attorneys or other representation, there are fewer evictions. Changing some of the underlying rules. I'm not going to spend a lot of time on this. I'm just going to flag it. There are some rules in the current landlord-tenant code that are very, we believe, detrimental to tenants. The 5-day rule. There are no minimum amounts. A landlord can sue a tenant over less than $1, and yes, we have seen a case for less than $1. It is clear then that they're just using that alleged delinquency as an excuse to try to get out a tenant. We need, strong fair housing enforcement. We need, source of income discrimination protections, and then the last one, which I think is really important and is a relatively new issue. Well, it's not a new issue, but it's getting a lot more attention, is record sealing. It's not enough that you avoid eviction. Tenants are often being denied housing because a landlord has filed a case against them in court, regardless of the result. And so there needs to be a way to make it so that tenants can get new housing. Next slide. I think I might be close to the end here. I just wanted to here represent sources of assistance for tenants. There's a Legal Services Corporation of Delaware that does private landlord tenant cases, and I've put up their website. Of course, us, Delaware Volunteer Lawyer Services, and then there's a legal help link where people can use that to figure out which of the organizations is more likely to help them. I'm happy to take questions, and I hope I kept it close to 10 minutes.
Thank you, John.
Yep.
We'll give just a moment in case anybody wants to enter a question in the chat for John. Ms. Jillian Austin was also able to join us. We are, before we move on to the Homes campaign and the policy work that they're looking to do in Wilmington, we are just going to revisit the vaccine prioritization conversation. And I don't see any chat questions. If anybody has any questions for John, you can feel free to email him or email me and I'll get that information to him. But Jillian, if you're ready, we can go ahead and let you go.
Good morning, everyone. I apologize for coming to the meeting late, and I only have until 11 o'clock, and I have to jump on another call. So I'm not quite sure what you guys covered in as far as the vaccination prioritization, but as you all know, it was announced that we are in phase 1B, and we are still working through our phase 1A healthcare personnel with direct patient care and contact. So those individuals will be your first responders, hospital workers, et cetera. We are also working with the long-term care residents and staff that are continuing to be vaccinated through the federal pharmacy program. Those that are in phase 1B include your 65 and older and your frontline essential workers. Again, fire, police, correctional officers, teacher, and education staff, and that includes your child care providers. It also includes your postal workers, your food manufacturing, your agriculture, transportation, and grocery store workers. We are working towards the next phase, the remaining phase for those within phase 1C. But right now we are addressing phase 1B. As far as how individuals register for 65 and older to be vaccinated, there is a link on the website for you to be vaccinated, to set up an appointment for vaccination. If you are not able to set up an appointment through the online registration, you can also call our call center and they will set up an appointment for you also. Those that are essential workers right now, you're going to be going through the vaccine planning. We ask that the organizations of those that are in phase 1B to go through our vaccine planning at delaware.gov in order to work as an organization to get those individuals vaccinated. That's kind of where we are right now, and I'm sure that there are plenty of questions, so I want to leave room open for those that would like to ask questions.
Jillian, this is Rachel. I will ask a question. I don't know if you have any update on if there are plans being made at DPH or DHSS or other entities to try to get folks in congregate shelters vaccinated, and if not, kind of what the thought is at this point on moving towards that population.
So congregate shelters are in the remaining phase, which would be phase 1C. I don't know that that's 100% been confirmed. The ethics board last week decided that that's where they would reside in the phase 1C. But I believe that the recommendation has also been made by Dr. Orte and Dr. Hong. So they are not in this phase of phase 1B right now. As we just opened phase 1B, but we are moving, they will be in phase 1C, in the remaining phase of phase 1.
Thank you, Jillian.
You're welcome. And as you can see right now, we did phase 1A, and we got as many individuals vaccinated as we could, and now we're moving on to phase 1B. It's with still vaccinating those in phase 1A. So there's not a hard stop. If you are in phase 1A, and you did not get vaccinated, you can still be vaccinated in phase 1B, and the same thing will happen as we continue through phase 1A, or continue through phase 1.
Thank you, Jillian. We do have just 2 questions in the chat. If you would be able to put the website for employers and the online registration link, if you would be able to put those links in the chat for everybody to access.
Yes, ma'am, will do.
Okay, those look like to be the only questions that we had in the chat. So thank you so much for taking the time with us.
You're welcome. Thank you for having me.
Okay. are going to welcome Anne Aviles and Amy Loader from the Homes campaign to talk about some of the work they are looking to do to promote housing stability in Wilmington.
Hi, good morning, everyone. Thanks for having us. Some of you may be familiar with Homes if you saw me at the annual meeting, and we have some exciting updates on things that we're working on. So I'm going to take us through the first few slides, and then Anne is going to jump in for the second part. And the two of us are part of a core team, but everything with Homes is based on community organizing. So everyone is welcome, and it's community member generated. Next slide, please. So if you haven't heard of Homes before, and this is new to you, just to give you a quick overview, we're focusing on all things housing, and right now in the city of Wilmington. And so we're looking at this campaign as something that's open to everyone that's involved with housing. So that's everyone from the unhoused all the way to landlords, and so everything in between, which is homeowners, renters, etc. And we are moving from the phase of planning into the phase of actually looking at policy and starting to roll that out for 2021. So that's what we'll be focusing the most on today. Next slide, please. So as I mentioned, we're community driven, and the way that we organize is we meet monthly as a whole, and anyone is welcome in that. So a lot of the folks that join us are working for other community organizations, nonprofits, agencies, and then we have a lot of individuals just from neighborhoods in predominantly Newcastle County, but we have had folks join us from across the state. And, you know, eventually this is something we would like to see statewide, because we operate from the place of housing as a human right. That's a whole Delaware thing, not just a Wilmington thing. And I think the key here is we have a bullet about a positive narrative. And, you know, we're really looking at housing as something that needs to serve all. And when you look at it as a human right, you know, everyone who's owning housing, delivering housing, in need of housing. And I realized I left off those returning to the community who are formerly incarcerated. So that's someone else, another group I want to make sure I loop into what we're covering. But anyway, when you look at that as, you know, everybody is included in this housing conversation. And what we're really looking at is making sure everyone has the opportunity to be housed and to have a home. It's not about, you know, pointing fingers so much as asking everyone to get on board to create good policy that will move our state forward, and in this case, the city of Wilmington forward, so we can actually see some progress on housing. Next slide, please. And so I mentioned policy and what we're going to be doing in the coming weeks. And we are, you know, are here today to brief you, but also to invite you into this, to attend, to spread the word, to participate in any capacity that you're available to give your time, is we're actually looking at a strategic plan for housing policy in Wilmington. And it will be phased. So we're looking at building, you know, in building blocks. And Anne will review that in just a couple of minutes. But really what we're looking at are what things can we address immediately, and then what things build on those. And then looking at rolling that out comprehensively. So it's kind of taking it piece by piece. And we really plan to do that from a community generated standpoint, which is getting people in Wilmington to understand like what the policies and practices are, getting them on board to support them. And then the people speaking to our legislators and our administration that this is what they want to see for 2021. And so that it comes from a place of the neighborhoods and the communities choosing this versus a top-down approach, which we've seen in Wilmington not go so well. I'm sure a lot of you are familiar with the whole blight bill thing that occurred over the last, I guess it's been a year and a half or so. So next slide, please. So I think I touched on a lot of what's on this slide. What, I just want to reiterate, we're really excited to have anyone join us who has expertise in housing or is just simply passionate about housing. And as we've been organizing, I'm not someone that's a housing expert. I'm someone that grew up in Wilmington, was gone a long time, and then came back and realized that, housing was a key need when I got back here, and just started to look for ways to plug in. So, and I've learned as I've gone. And then we're, fortunately, we have folks like Deborah and Anne who have lots of experience with housing. And so together we're able to, put ideas forward and move things forward. So it's really collaborative. And it's been, I want to say, the folks that have been showing up from different organizations to the monthly meetings have been essential in sharing important information. And that alone has served us greatly. So if housing is something you're passionate about, everyone is welcome to either join as an individual or also representing the organization that they work for, that they serve. So there's multiple options there. Next slide. So just to go over, I'll go over high level, just the different areas we're covering, and then Anne will jump into policy. So there's several areas that we're focusing on. And as I mentioned, they'll be building blocks. So the first one is creating fair opportunities for homeownership. We also have creating high quality rentership opportunities, restoring vacant properties. And you can see there's specific bullet points under each. So the policies that we're designing and the different ordinances that we may be requesting to have changed will cover each of these areas. And if you go to the next slide, the others are listed there. And then the two others are ending homelessness and creating opportunities for returning citizens to access quality, affordable housing. So now I will turn it over to Anne, because I think the next slide hits on the policy points. Yeah.
Hi, good morning, everyone. And as Amy said, thank you for having us. So I'll just talk very briefly. As you saw in the previous two slides, this is a very comprehensive plan. And so we are hoping actually in early February to launch a website that will contain a list of all the policies, ordinances that we are looking to either enforce, right? So this first one is this housing advocacy priorities. These are ordinances that are already on the books, right? So all rental properties are supposed to be registered and licensed. What we have learned is that maybe 35%, right, of rental properties in Wilmington are actually registered. So this isn't something new that we are asking for. This is simply enforcing a ordinance that already exists, right? So we're really thinking about how do we ensure that every property is registered and licensed, because we believe that will then support safe, affordable, and adequate, I think most importantly is adequate housing, right? So that everyone is able to, any renter, right, make sure that they have that access, and that landlords and homeowners, right, are meeting their roles and responsibilities as providers of housing. So if you want to go to the next one, please, which I think is probably focused on, yeah. So regulating the rental properties, I'm repeating myself here, right? So we're really trying to think about a mandated system, and we really want it to be a public facing system so that any renter, right, any homeowner can go and make sure that their property is registered and licensed, right, with L&I. And if there are any issues as a potential renter, right, you could go on a website and just find it. Now this will be further on down the line, but that's just one example, right, of a way to ensure that we enforce this. And then also we're working with landlords to get their input. And many of the landlords we've spoken to so far, especially those that are already meeting these criteria, feel that it should be something, right, that all landlords do. Next slide, please. So promoting tenant rights is ensuring, right, I think we went too ahead. Just, can you go? Am I frozen?
Hi, Anne, this is Rachel. I don't know if you can hear me. You are breaking up a little bit. You are frozen on my screen.
Oh, can you hear me?
I can hear you now.
Okay.
Feel free to turn off your video if that will help with the connection.
Okay, did I freeze?
Yeah.
Okay, I'm going to stop my video just to try to keep this moving and we can stay under our 10 minutes. So we are, one of the partners with CoC and really ensuring, right, that tenants know what their rights and responsibilities are. And then this final slide here is focusing on unfair fines and fees. Many times people that are experiencing homelessness, right, they are basically financially reprimanded for the fact that they don't have a safe, stable place to sleep every night. And so we're trying to end these kinds of policies and practices because we know it does nothing to support, right, them getting access to housing. Next slide, please. So as Amy outlined, right, we really want this to be collaborative. We want to continue to involve people. We know that, HAD and CoC, you all, are advocates and work directly with various populations experiencing housing issues. And so we really want to focus on getting everyone's input and support. So next slide, please. I just want to highlight right on the, oh, that's okay. The pictures you saw earlier were from our earlier launch. And so just to reiterate that this really is collaborative. So thank you all for your time.
And we just have one question in the chat from Dr. Matro at the University of Delaware. He would like to know what the City of Wilmington's position on better enforcing current landlord registration requirements is, if you knew anything about that.
That's a great question. I don't know. Let me just start there. As I said, we've met with some of the landlord groups in Wilmington, and the landlords actually support the enforcement of that ordinance. So I would think that the city officials would be in support of that as well. What we've been told is the greatest challenge is L&I and in their capacity to enforce it. So we are collaborating with landlords to identify alternative means to ensure that this can be done. So one example that we, are kind of floating around is, what if landlord and tenant had a checklist and there was a third party, right, where they went through the checklist and the tenant could sign off, the landlord could sign off, and then this neutral third party would be present for that. So then it wouldn't require more effort from L&I, but it would allow, right, the landlords to rent their properties in a timely fashion, because that's the landlord's concern, that if they have to wait for L&I to come out, then they may miss out on a potential renter. And then the renter is also, right, safeguarded by ensuring that the unit was in condition, right, to be rented. So hopefully we'll hear from City Council, right, as we kind of roll these things out, and we're hoping that they get behind us on these ordinances that we're trying to simply enforce.
Awesome, thank you so much. Anne and Amy have posted several resources in the chat in order to get a hold of them if anybody else has any other questions. So with that, we are going to go ahead and move into our COVID-19 updates. And the first one we have is centralized intake data, and Rachel is going to take it away.
Yep. So thanks to our centralized intake team and Lisa Forever in particular for helping us track and present this data to the community. So this is here, and we have been sharing these regularly via email push. So for those of you who are on our CoC membership list, you should be getting monthly updates with some of our data and information. This data just shows us how many folks are reaching out to us for help. How many times, how many households are reaching out for help, how many of those households are families with children, at risk of complications from COVID-19 if they self-report to us that they have a medical condition as defined by the CDC, that they are at risk of severe illness if they were to contract COVID-19. And how many referrals our team has been making to both emergency shelter, which we refer directly to, as well as the State Service Center for potential placement, possible placement in a hotel or motel space throughout the state. So all of these numbers are statewide. Not everyone who calls is homeless or wants or needs homeless assistance resources. We get a number of calls from folks who are maybe behind on rent, concerned about potential eviction, or have other housing concerns or issues. So you can find some more detail about the type of households calling us, where they're living, their living situation when they call, whether they're calling from an unsheltered situation, whether they're calling from, and they currently have housing, but have other housing needs and issues. You can find more of that detail on the information that we've been pushing out through our constant contact list, and as well as on the centralized intake page of our website. And so I've put the link there. Next slide, Erin. And just a brief update, things look pretty similar to when we last updated you all on the congregate sheltering bed availability. Statewide, we're still just under 60% of congregate shelter beds being available for folks due to the safety precautions put in place by COVID-19. The numbers here don't reflect the Sunday breakfast missions beds in Wilmington, and nor do they reflect the current capacity increase provided by our Code Purple partners. So this is limited information, but does cover the primary, all of the shelters that we partner with for direct referrals to congregate emergency shelter beds.
Rachel, we do have a question in regards to the last slide. It says, is the number of inquiries for assistance the base number, and is it an unduplicated count?
Sure. The number of inquiries for assistance is the total number of inquiries, whether it's a phone call, an email, a text. People can reach us through a variety of ways. So it's the total number of inquiries. That second number, Erin, if you can go back one slide, that second number, number of households, that is the deduplicated. So for example, in December, we received 1,700 inquiries, calls, emails, et cetera, from 939 unduplicated households. Okay.
Awesome. If anybody else has any questions regarding congregate shelter or the centralized intake data, you can feel free to reach out to Rachel, myself, Lisa. All of us would be available to direct you for that information. And with that, we are going to move into our Code Purple presentations, starting with the Newcastle County Hope Center.
Good morning. Thank you so much, Erin. I'm Nicole Waters, Housing Management Analyst for Newcastle County's Department of Community Services, where I administer our Community Development Block Grants and Emergency Solutions Grant programs, as well as my new role as Director of Operations for the Newcastle County Hope Center. I'm really excited to share this new information with you all. Thanks for the opportunity. We've been open for about 1 month and 5 days, I believe, and we're making great progress. And I'll add the Hope Center website information to the chat after my presentation. Could I have the next slide, please? So Newcastle County's CARES Act Task Force was formed in July of 2020 after the county received its $300 million allocation to assist those impacted by COVID-19. Early on, the task force sought to purchase a hotel or a building and convert it into temporary shelter before the funds expired on December 31st, 2020. The task seemed impossible until this happened. It made headline news and was plastered all over all social media outlets. We knew immediately that it would make the perfect shelter and social services hub. Next slide, please. So in what turned out to be the most watched Delaware commercial real estate auction in recent memory, Newcastle County won the bid and used our CRF funds to purchase the Sheraton Wilmington South that's located at 365 Airport Road in Newcastle. We settled on the property on December 1st, 2020, with the intent of reopening the hotel as non-congregate temporary emergency housing for people experiencing homelessness during COVID-19. We opened on December 15th, 2020, with 73 pre-registered guests through the Friendship House, and we began accepting center hotel motel voucher referrals from the state service centers on December 29th. Next slide, please. But before opening, there were some building enhancements that we needed to secure. Of course, this was a hotel. It was meant for privacy. There were no security cameras anywhere. So this included a new state-of-the-art security system that has 68 cameras, secure exterior doors, panic buttons on each floor, and accessible controls via the internet and cell phones. We added enhanced lighting in the parking areas and had glass installed in the open atrium areas of the building. We added security fencing and lots of new signage everywhere. Of course, a lot of COVID protocols needed to be put in place. As Carrie mentioned earlier, we built a temporary wall for people that were symptomatic of COVID-19. And we had signage screenings upon intake and entry, and actually ongoing COVID testing as well. We also have partitions throughout the building in areas where people could possibly congregate, although that is really prohibited. We also have on-site laundry facilities that are in progress right now. Next slide, please. So here are the Hope Center demographics. The Hope Center has 192 rooms, of which 143 include a mini fridge and microwave. We have 176 that could be occupied, and currently 81 are occupied. And the current guest breakdown are 129 guests, 99 adults and 30 children. We have 9 pets now. I've met the dogs. I've met 2 of the cats, I believe. I've not met the guinea pig and the bearded dragon. So last night when I saw that, I was really surprised. So I have to make it a point to meet those pets. Next slide, please. And of course, we understood early on that this was a tremendous undertaking, and that the project has many moving parts. I mean, it's a hotel. We have to have services. We have to have partnerships. So we understood that partnerships were essential. They were vital, and that the opportunity to make a transformative change was now, and that the mission had to be to secure those great partners. So here's a list of some of our partners that we have right now. Next slide, please. So Friendship House operates the Code Purple program at the Hope Center. And Code Purple does look different this year because of the pandemic, right? So as I was doing this last night, I thought, there's Target and then there's Target, right? So there's Code Purple and then there's like this Code Purple. It's just not the same Code Purple that we saw before COVID-19. And it's Code Purple, I guess, because every night, not just when temperatures are below freezing, it's open and guests can stay 24/7 and it's non-congregate. So that's really, it's vital right now. It's very important. And the programming at the Friendship House consists of 24-hour staffing, nutritious meals, and they get 3 meals a day that are delivered directly to their door by an outside vendor that provides the meals, and Friendship staff delivers the meals. So we don't have people congregating and standing in a line to get their meals. And then the case management, which is their intake, their assessments and screenings, referrals, and the next step planning. What's great about this project is that there are multi streams of funding. So funding comes from the City of Wilmington, the City of Newark, and Newcastle County. Funding has come from CRF funds and from our HUD CARE CDBG funding as well. Next slide, please. According to Delaware State Housing Authority's Homelessness in Delaware publication, more than 50% of all homeless persons consistently identify themselves as having mental health or substance abuse or substance abuse conditions. So we were very pleased that the Divisions of Substance Abuse and Mental Health decided to operate their Bridge Clinic out of the Hope Center. So they will offer screenings and referrals to treatment, access to on-site clinicians, guidance navigating that care network system, and they're preparing to be there 24/7, which is really good. They're gearing up as we speak, and that's very vital. We were very excited about that partnership. Next slide, please. I think Erin and I were just discussing this lovely lady earlier. I just met her a month ago, but I already am in love with her. So Dr. Gibney began providing medical exams at the Hope Center on January 18th and will be there on the 25th and February the 1st as well. I'm looking really forward to this ongoing relationship with her. She comes with vast knowledge, experience, and she's a champion of those experiencing homelessness and comes with just a great sense of humor, straight shooter, and she knows her stuff. So I'm really honored to meet her, and she's going to be a valuable asset to the guests at the Hope Center. Next slide, please. Within the first week of opening the center, the St. Francis St. Clair Medical Outreach Van came to our site to provide on-site services to our guests. They could receive physicals, preventative screenings, access to prescriptions, referrals, lab tests, and all this is available right there. It's really awesome. They currently visit twice a month, and I saw that they are going to begin some podiatry type of services in February of this year, which is very important. The guests really love this. At the Hope Center, we advertise it so they're made aware when the services are available. And I believe as of yesterday, it's now on the monitors and computer screens so guests can see exactly when and where services will be available. Next screen, please. I think this is one of the most unique things about this. Of course, you know, Carrie and I, we know the service providers, we know all the homeless service providers, we know who to get to provide services to the guests there, but we didn't know anything about operating a hotel. So again, in the early stages, we decided to engage Hersha Hospitality Management, it's a lot of H's there, group, and get them to actually stay on board and operate the Sheraton and run the facility. So we did negotiate a contract to keep some of their staff to manage the hotel, and that's the housekeeping, the maintenance, the referrals of intake, inventory of rooms, and engineering. So we have a general manager still on site who comes with over 20 years of experience, and I believe she's been at the former Sheraton for about 10 or 12 years. The assistant general manager as well, 3 engineers, a front desk supervisor and front desk staff, housekeepers, housemen. It's really nice. There's over 15 people who were able to stay to run the facility. They do a phenomenal job and they keep everything running smoothly. And I remember when we first acquired this hotel, some of them were a little nervous. And I said, well, you guys are in the hospitality field. This is what you do. You serve people. It's the same concept. It's just a different population. But we reassured them they're there to run the operations and keep everything running smoothly. And they're doing just that. They're doing one heck of a job, and we would be lost without them. Next slide, please. And I saw somebody did mention this in the chat. Yeah, I don't know how many times in my regular job with the county that I would get calls from people experiencing homelessness who actually were about to be placed in a shelter, but they had a pet and they could not take their pet. And I would try to convince them not to take their pet. And I understood because I had a pet and it's my family, you know, and they would deny or say, no, I don't want to go into shelter care. I don't want to go because I can't take my pet. So we knew early on as well that this was a barrier to people and that we had to, you know, allow pets on site, that people could bring pets, but we realized that also we wanted to make sure that the pets that were there, you know, had their vaccines, that they were properly trained, and that everyone had what they needed to keep that pet safe, but also keep others safe. So I was really excited about Faithful Friends Animal Society and the partnership with them. It is huge. They perform weekly assessments, exams on the animals. Microchips are available, preventative services, vaccines, and behavior management. They also provide supplies for the pets, bowls and a leash and carrier and pet food as applicable. So I'm really excited about that because we understand how important it is for a person to stay with their pet. That is their family. And we are so happy that we were able to fulfill that, you know, that for those individuals, that gap in service. Next slide, please. And of course, transportation and security, that's very important. If anybody knows where the Sheraton is located, it can be a little tricky getting there. We don't have a designated DART stop as of yet, but I'm claiming that we will. When we acquired the hotel, we also acquired all the contents in this hotel, and which included a couple of vans. So we do have one van that we were able to keep to use as shuttle services. And then we were able to purchase 2 new vans, state-of-the-art, brand new, 11 passenger handicap accessible vans with a lift. There's the lift at the top left corner there. And Living Grace Worship Cathedral, doing business as Grace Transportation, will be providing transportation services to us, and we'll follow the current transportation schedule that we do have right now. So we have shuttle services at the Hope Center that start at 7 a.m. and depart the Hope Center on the hour every hour and take people to the DART Price's Corner bus hub. We do plan to add another DART hub, Christiana Mall, as well. And then they come back from the hubs every half an hour. The last pickup at those hubs are going to be about around 6:30, 7 o'clock. And if people cannot use the shuttle because maybe they need to get to work a little earlier or get to a doctor's appointment, we do have Lyft and Uber gift cards available for them for those hours. We have 24/7 security in addition to our security systems, and we're staffed with 2 security officers per shift. So one officer is in the control room watching the cameras, and the other one patrols and walks the outside grounds and walks the interior of the Hope Center. And halfway through, they do a switch. So we do have 6 officers during that 24 period of time in the facility. Next center, please. I'm sorry, next slide, please. Thank you. And the Hope Center does not take walk-ins at this time. We began receiving referrals on December 29th, as I mentioned earlier, from the State of Delaware Division of State Service Centers through their hotel motel voucher program. We promote the use of our state centralized intake services system and encourage those experiencing homelessness to contact them via phone or email. And that's what we promote when we get calls, and we do receive calls, and we make sure to forward them to centralized intake. Next slide, please. Just wanted to show you a few pictures of the Hope Center before we settled on the Hope Center. I think back in May, there were about $6.4 million worth of upgrades done to that facility. A lot of the rooms had never even been slept in because it was during the pandemic and they were not operating at full capacity. So the place is beautiful. I know that Carrie's been doing a wonderful job doing virtual tours, and I think that's going to take off in a few weeks. I hope to do my first virtual tour and show you every nook and cranny of the facility. But the top left is our lobby area, very nice and inviting there. The bottom left is a sitting room in one of the junior suites. In the middle, you have one of the bedrooms that looks like that's a king bedroom in a suite. The top right is one of the many meeting rooms that are there. There are 8 meeting rooms, and that's one of them. And that's where we hope to eventually have more partners and services provided out of those meeting rooms. And the bottom right is our outside terrace smoking area. We don't have furniture there right now. It's just an open area because we also want people to there as well, social distance and not get too comfortable congregating in areas. So it's all open so people can safely spread out. I will post the Hope Center website. We have a website, we have a Facebook page, and a lot of information about if you're interested in volunteering, who to contact, or if you have a monetary donation, or if you have a donation of another kind, who and what numbers to call or emails to use to make those connections. Thank you so much for your time. Enjoy the rest of your presentation. And I'm sorry, I guess I'll take questions if anybody has questions at this time.
Nicole, I'm not seeing anything in the chat at this moment, but I'll just add, I think now's a good time just to remind folks about how access to the Hope Center works. So just as a reminder, folks can call 1-833-FIND-BED if they are in need of shelter, and we do our best to get folks access to whatever shelter is available in the state, but we do not make direct referrals to the Hope Center. So folks who call us in need of shelter, we, same as we do for many others, with any other type of hotel or motel that the State Service Center partners with for non-congregate shelter, what we first do is we help that person access congregate shelter if that is available and if it is safe for them to do so due to any COVID-19 risk or concerns they might have. If there is not congregate shelter available for that person, or if that person meets one of those health risk criteria, we send a referral directly to the State Service Centers, and then they do what it is they do to assess a person's eligibility and look at their inventory of hotel and motel rooms throughout the state and make placements for folks that way. So we do not make direct referrals from centralized intake to open rooms at the Hope Center. And I think that's an important message for everyone to hear and share as widely as possible. So I just wanted to add that comment.
Great. Thank you so much, Rachel. I appreciate that.
And thank you, Nicole, for your presentation. It looks like there's a question about when will the Bridge Clinic go 24/7? So I don't know if you have any insights for that, Nicole.
Sure. I'm not completely, I know they're gearing up. We're ordering, they're taking over one of the spaces in the hotel as office space and their clinic, and then some of the suites they're going to use as their treatment rooms. So we're getting everything in the room that they need to do their jobs, and they are there a few days a week, but they are ramping up to be there 24/7. I would anticipate within the next 30 days that they should be there 24/7, unless, Carrie, you have some different information to add.
Thank you, Nicole.
You're welcome. Thank you.
It looks like we have one additional question. Are Code Purple accommodations available to all in Newcastle County?
Code Purple, yes. At this time, we are full with Code Purple at the Hope Center. We had 73 pre-registered Code Purple guests, and that's we're full now. Now we're solely working on referrals. And like Rachel mentioned, that referrals come from the State Service Center. So they coordinate with all the hotel inventory throughout the state. And if that family or that individual meets the criteria and we have the availability there, they are placed at our center. But we are currently not taking any more Code Purple guests.
And I'll just add one thing. The Salvation Army is still operating Code Purple when the weather in Newcastle County, when the weather falls below, I believe it's 32 degrees at night. And they're open all week this week, but only for families with children and single women. And so folks can show up on site in Wilmington at the Salvation Army for that service starting, oh, someone else knows this. Starting at 9 p.m., 6 p.m., 8 p.m., something like that. We can get more information out to folks if they need it. Lisa, you should feel free to add that information, or anyone from centralized intake who's here, to the chat.
Okay, and next we would like to welcome Ennio Emanuel, who runs Code Purple County.
Hello, how's everyone doing? Can you hear me?
Yes.
We can hear you.
Awesome. All right, so thank you for having me. We're so thankful to be a part of this update and this quarterly meeting at CoC Purple Kent County. You can see there the 1-800 number. If you have anyone in Kent County that needs sheltering for emergency purposes, you can call the 1-800-733-6816 number. And also the email codepurpledelaware@gmail.com. So you could always email us there if you have, if you want to give us updates on cases, or if people, any of your clients might need supplies. We do operate the emergency shelter right now. We're open every day until the end of March 31st. And so that's something that we're open at 5 p.m. and we close around 8 a.m. daily for women and children and for men. At the moment, we do not have a site for men with children, or we do have children at our women's site, and we have a woman who is a sex offender. We do not have a site for women who might be sex offenders. So that's something to keep in mind if you have any of those cases come across your path. At our site, you can change the slide for me, please. Okay, at our site there at the Casa Maranatha, the 1207 East Division Street in Dover address, that is also where our women and children stay. We can have about 22 women and children at that site. And we also have transitional housing. We have 4 bedrooms that service for transitional housing, group home setting for permanent residents there. So we do have, some transitional housing, and we do emergency sheltering at the moment. And then also at that address, 1207, you will find Monday through Friday, we do have a pantry with clothing and food and hygiene products and supplies that are available to the public. We get a lot of referrals from the James Williams Service Center, from different churches. So we're open Monday, Wednesdays, and Fridays from 9 to 12, and Tuesdays and Thursdays from 1 to 3 for people who might need supplies. And then we also, other than emergency sheltering, we are servicing about 32 people living in hotels. We're giving them about 1 rescue bag a day, or 1 rescue bag a week they can use it every day for about that week. And we're doing that on a consistent basis right now. It's over here at People's Community Center. You can see there at 46 South Bradford Street. We also have a pantry there that services men. We do have about 45 men that come to the site to get supplies, clothing, food, hygiene products, anything that we can offer. We have a pantry there set up just for men. We can do emergency, that's where we do our emergency shelter as well, and we can house around 26 men at this site. Normally we would do approximately around 45 men, but due to COVID-19 restrictions and just volunteer, restrictions, we are just trying to do what we can so we can fit around 26. Now, we've already had around 41 men come in at one time trying to find shelter. So that is something that is really concerning for us. We do walk-in, so you don't have to reserve a spot. At the moment, we do a walk-in process, and if you've been there the night before, we do allow you to reserve your bed if you're going to be coming again. If you're not going to be there at 5, we work with people if they have a job. We notate that on their account. And so we just try to make sure we keep up with them so that, if they're out and about in their daily lives, they know that they have somewhere to go back to at the end of the day if they've been there before. If you have new clients, the setup process is they would walk in, they'd be greeted by a volunteer. CoC Purple King County is very volunteer based. I think this year, with everything going on, we've been able to grow and do more services. And so we definitely are working now to have a set staffing that is just, people who are going to be trained to do a certain work a certain way, not just volunteers doing it out of passion. So we'll mix that together here this year for sure. And so when someone walks in, they get greeted, they have to do an application process, sign some paperwork. When it comes to the COVID-19 precautions, we do take temperatures. We do ask you for symptoms. We have a questionnaire. And then, on the site, we do have plexiglass separators. And some of on the men's site, and the women's site has separators by like hospital bed separators. So that is something that we've done. And we also, for COVID-19 precautions, we're doing fog spraying, UV light rays. We do have a doctor on our board, Dr. Maribel Garcia from BB Medical. So she has been frequently visiting all the sites and all the people and trying to make sure they're doing their due diligence in their health. And that is something that we want to grow on and try to work with other medical professionals to come on in, and on the hours that we're there to offer those services and connect them to places like the Bridge and other services. So our current capacity right now, we've been doing really well. You can do the next slide. Thank you. Some of the challenges that we're facing at the moment is, since we were, I'm the president of CoC Purple as of last year. So before that, CoC Purple was always volunteer oriented. So, when COVID-19 hit, a lot of our volunteers who were retired are very scared to go out. So that was something we didn't know what to expect, how that was going to go this year, but we have been able to have volunteers help us out and make this happen. But we also, like right now, many of you know in your own personal families, last week, there was an uptick in COVID cases all across the board. And so when those type of things happen, even if someone doesn't have COVID, the hysteria creates an issue with volunteers. So that is just more of a need for me to work with our team to create funding opportunities for staff, where, we're able to have people who are passionate, but they have bills to pay, and so we have to, that's something that we have to grow into, and we're definitely working hard to do that. Space limitations versus need, our budget was small to be able to put people into another type of room situation where like a hotel, if we did go over capacity, thanks to God, we, last year we were able to win some grants and some funding. So we were able to, where we thought we would be suffering, God really provided, and we were able to put people in hotels when we were not able to fulfill the total capacity that was needed. Now, another challenge that we're facing is that we would love to see more presence of other nonprofits that do drug counseling and, when it comes to housing assistance and trying to find ways where the individuals, because when we close at 8 a.m., there's really nowhere for them to go in the interim. And, there's certain guys that we can train as much as we can train to do what they have to do to get to the service center or to another agency. But if someone doesn't show up, between 8 a.m. and 9 a.m., they could be lost for the rest of the day. So it's like trying to find ways to reach them and get to them right when they're there and present and, able to be touched. So that is something that we're working on and trying to create more transportation opportunities. And that's a goal of ours this year to work towards a part of our nonprofit, something that we call Care Rides, where we'll be offering 5 monthly rides, 5 rides a month for, the local county, and you just pay $20 a year, and then you would get the membership, and then we'll work, the other part of that would not be provided in the cost would be grant funded. So that's something that we're trying to work on and working with the public and people who love to drive as well. So the successes that we've had this year, we really haven't had any issues with COVID cases since the beginning up until this actual week. So this week was the first time we've had to encounter any of our volunteers or clients getting COVID. And so that was, we were really worried. We had people who had symptoms and we would have to separate them. If people still had symptoms and they didn't have COVID, we would still, work with them to put them in hotels, because it was just, some of the tests are false negatives. And so you find out later on they're actually positive. And so those are things that we, because we have a doctor on our board, we're able to kind of plug her and get some advice. Sorry about my phone. It's always going off. We've had, so dealing with COVID right now and having to make sure that we keep everyone safe. We do have a lot of people in hotels at the moment on our dime. So we are really, trying to keep everyone safe, trying to keep the volunteers safe, trying to keep everything alive. And so we have a lot of people quarantining in hotels at the moment with us. Just we have COVID cases. So just that whole process of transporting people, making sure people get tested. I know the same day test for us has worked really well in the Smyrna Express Care. If you're in Kent County, the Smyrna Express Care by the Wawa they're not only very professional, because I've gone to some urgent cares that don't even want to work with homeless people. And so they're really professional there, and they do it all. I've taken 9 guys at a time, and they get it done within a couple of hours. And if there's anyone with pneumonia, which we only have one gentleman that they said had pneumonia, but then the hospital said he didn't. But if you have anything like that, they'll send them right to the ER. So those are things that we have to go through, and finding people who want to be in a van with people who might have COVID, might have not, is you can't. I probably couldn't pay people $1 million. Some people $1 million to do it. So it's been challenging, but we've been able to. This week has been a very, very difficult week, trying to make sure that we don't have anyone with COVID in the facility. So we are actually asking people to get tested before they enter the facility for the men's site, because the women's site is very good, clear. The men's site, I don't know where we're trying to find out where it started from. We think it might have actually started with the volunteer. And so we're tracing that, and we're just transporting everyone, getting everyone tested. And if anyone is positive, we have hotel partners that are helping us to quarantine. And the really great thing right now, our food supply inventory is doing good. We've been doing a lot of drives for food. Yes.
I'm so sorry to interrupt you. I just want to ask, wrap up in the next few. We're running a schedule.
Yes, I got you. So yeah, so we do. So food is good. If anyone wants to donate food, they can always donate to our office. We have the food supply. We do breakfast and dinners and a bag lunch. So that's always great. And I just want, and another success is the community has really come and supported us. Newcastle County has helped us. Their council has helped us more than my Kent County council has, but our council here in Kent County has helped a little bit as well. The Kent County Levy Court, they're helping out. And so other nonprofits are doing their part, and we're working together. Other CoPurple, Sussex County, Newcastle County CoPurples, just with communications and just knowing if we have each other's back, have been good. And so for that, I'm very thankful, and I thank you for your time. All done.
Thank you.
Thank you. Appreciate y'all. Let me know if you have any questions.
If anybody who has any questions, please put them in the chat, or feel free to send them to codepurpledelaware@gmail.com. Great, we are going to move on to Susan Kent, who is going to give the update for Sussex County Code Purple.
Hi, it's good to see everyone today. I'll keep this brief. I know the meeting's going over. I'm going to put in chat everything you need to know about Code Purple Sussex County. My name is Susan Kent. I'm the Executive Director of Love Inc. in Mid-Delmarva. We started doing Code Purple in Sussex County in 2014, and this year, we, obviously, as Enio has stated, everything has changed slightly because of COVID-19, but we've had a great year so far. We have 6 sites available. We do have both paid and volunteer this year. Because of COVID, we were able to secure some overnight staff. We do follow all the CDC requirements for congregate shelter. We screen ahead over the phone and take temperature at the door. We can serve men, women, and women with children. And our capacity each night, we're open every night. We always have been since I believe the first year we were temperature controlled, and then we decided to be open every night in Sussex County. But we have capacity for 84 souls each night. We have a 24/7 hotline. Our fearless leader, Nikki Gonzalez, is our Code Purple director. She does hold the Code Purple hotline and will answer the phone, and does often for law enforcement or mobile crisis, or lots of phone calls happening at 12 a.m. and 1 a.m. So we thank her for her service. To get into Code Purple Sussex County, we ask Monday through Friday on the regular workday to call 302-629-7050. That's Love Inc.'s number, and we do have them sign up each night for their bed. And then after hours, they can text or call that hotline. We do have, because Code Purple Sussex County is under Love Inc. umbrella, we have access to everything anyone would need as far as clothing, dignity supplies, those sorts of things. And we're really pleased this year to have a great partnership with the Community Resource Center in Lewis. And just they have a day center during the day, and just know that our guests are getting further care and things happening during the daytime. Because Code Purple at the heart is literally the least we can do as a, in its model. It's keeping people alive. Its model is a low barrier, come in late, leave early, keep people alive. It literally is the least we can do as a society to help our homeless, and to add resources to that, and to give dignity, and to have community partnerships. And COVID has, caused quite a stir and trouble and a lot of the work, but also it's allowed us to be more intentional about our partnerships. So we're thankful for that. If you have any questions, just reach out to us. We're very active on Facebook, if you have any questions, just let us know.
Thank you so much, Susan, for the time and all the work that you're doing down in Sussex. We are going to move on to our non-congregate shelter update with Faith from DSSC. And go ahead, Faith.
Great, thank you, Erin. Can you hear me?
Mm-hmm.
All right. Good morning, everyone. My name is Faith Moore. I'm the new Deputy Director of the Division of State Service Centers. Thank you so much for the opportunity to present some of our data highlights in relation to non-congregate emergency housing for the homeless as provided by the Department of Health and Social Services. Many of you would agree that experiencing housing insecurity at any time is a struggle, but during a pandemic, the consequences are even more dire. For the individuals and families we serve. We are so thankful to the Continuum of Care and all the partners on this call for your hard work and your continued commitment to these very vulnerable Delawareans. On this first slide, basically what I have done is I have updated some of the data that was shared by Director Renee Beeman during the last Continuum of Care meeting. This chart now shows that since January 2020, the DSSC, as part of COVID-19 planning, prevention, and response, has housed close to 1,800 unduplicated households in non-congregate shelter settings. These are primarily hotel rooms provided in partnership with hotels and motels throughout the state. As some of you are probably all aware, the division has historically provided emergency shelter in motel and hotels when and only if free emergency shelter is not available within our system of care. What this slide probably does not show, or the story doesn't tell, is that the pandemic has had us seeking new solutions to pivot and to adapt to this new norm. The new norm being that whereas before we could place a family in a motel and then move them out within 1 to 3 weeks into a shelter, we're now keeping most clients a minimum of 3 to 4 weeks, which was or used to be the maximum. And in some cases, we're keeping clients up to 6 months or beyond. So this has been a result has been a result in the increased need as well as the lower capacity that we're seeing in shelters necessitated by the need to adhere to CDC guidelines. So the lower part, well, let me say the upper part of this PowerPoint, you'll see the number of household members that are housed within the 1799 unduplicated households, and that's 3,860. We've also housed 1,700 children during this pandemic. And we've also been keeping track of the number of individuals who are over 65 and older due to their vulnerability to this virus. And that's that number 73 on your right-hand side. The lower chart is essentially the intake totals per month. You can see we had an uptick in April, another one in August, and we seem to be kind of plateauing a little bit or going a little bit on a downward trend. However, you know, we've seen the chart go up and down depending on the COVID numbers. So we are, even though we're cautiously optimistic, we're not certain what will happen in the next few months, especially as rental moratoriums are lifted. Next slide, please, Erin. So in terms of intakes by county, you can see the highest county is Sussex County with 743 households that we've housed. Newcastle 621 and Kent County 433. At the bottom of this slide, I also wanted to pinpoint or highlight the primary income sources reported at intake, just so that you all can see maybe, you know, what are some of the challenges that are causing our the population to come into our state service centers in need of housing. So you can see most of the individuals are reporting that they are they don't have any jobs, they've lost jobs. We've also had people come in because of medical issues, disability issues, lack of trusting relationships whereby someone has ended up, they were living with someone and then they were kicked out of their home, abuse, domestic violence. We have a myriad of reasons why people are within our non-congregate shelter settings. And this has led to us having to pivot, especially since we're housing individuals for this length of time, to provide wraparound services. And that's what we have at the very top of the chart. I listed some of the services that we have provided in the last year or so. We have distributed food through the Food Bank of Delaware, masks and hygiene kits, rapid rehousing services through partners such as Family Promise and Catholic Charities, employment supports through the Division of Social Services, connection to benefits, mental health resources. I heard some of you talk about the Bridge Clinic, which is also partnering with us, mental health resources. We've also been providing isolation housing since March. And Lisa asked for the flyer that we're utilizing with hospitals and other clinics. If any of you is interested or at least has a patient who is homeless and in need of isolation services, reach out to me or reach out to Lisa or Rachel, and we'll be sure to send you the referring form as well as the criteria for housing. We've also provided COVID-19 testing on site at hotels and motels, school supplies, and we're very proud to also have piloted a learning pod, a virtual learning center at one of our sites in partnership with this Christina School District. And we're hoping to pilot yet another site, hopefully at the Hope Center in the next couple coming months. So we have a lot going on within the Division of State Service Centers. If you're interested in partnering with us or maybe getting more information in terms of what it is we're doing, some of the numbers around and data around the services that we're providing, please feel free to reach out to myself or Director Renee Beeman. Thank you for your time. Thanks.
Thank you, Faith. That's very helpful. And with that, we are going to move on to our last presentation with Marlena Gibson from DSHA to talk about the emergency rental assistance coming to Delaware.
Yes, good morning, everyone. There are some interesting updates here, and I will give a little overview of kind of where we've been in the last almost year on emergency rental assistance and some updates from the recent relief bill. Next. So in very late March of 2020, we launched the Delaware Housing Assistance Program to provide emergency rental and utility assistance at that time. That early version of the program ran from March until about August. In August, we relaunched it in a new version that had been reformatted some. We had worked on the application process, tried to address some tweaks, and also structure it so it could do more volume and hopefully move a lot more folks through a lot more quickly. The program, by the end, we made a lot of tweaks along the way, was able to offer up to $8,000 in arrears, current rent due, and we were doing up to 1 month in advance. It was limited to rent due from March 1st, 2020 to December 30, 2020 only. The primary funding source we had for that was the Coronavirus Relief Fund. Next. In those two versions of the program, we'd help. This was actually as of last week. I just ran this again this morning. It's more like 3,700 now, 3,700 households. There's a little bit of duplication there from folks who got assistance in the first round of the program and the second, but mostly unique households. And assistance is a little bit closer to 13 million now that's been approved and distributed. Under review, applications that were submitted before the deadline of December 30th, that number is a little high. It includes a lot of applications that were submitted earlier on and were reopened. There are some, duplicate applications and things like that in there. The realistic number of ones that are really still under review and have been reopened, we're awaiting edits, is more like a few hundred. So we're working on kind of closing some of those out and really trying to wrap up this version of the program as we look ahead to what's next. Which is some new emergency rental assistance funding that was established in the relief bill that was signed just before the end of the year. It establishes a new federal emergency rental assistance program with $25 billion nationally. $200 million of that is expected to be coming to Delaware for the small state minimum, which is a really huge number. That is a lot of rental assistance, which is wonderful, because I think we can really address a broad range of needs there. It can be used for rental and utility assistance, and there is a slice for administration and housing stability services, which is still pending definition from the Treasury Department. The bill itself is pretty vague on a lot of things. So we are in a kind of difficult limbo area where we are trying to plan for a very large new source of funding very, very quickly. But there are quite a few things that we don't know yet, which is making that a little difficult. There are some things around how income is certified, how COVID-19 impact is certified, where we really are looking for more guidance from the Treasury Department. A little bit was just issued yesterday. Some of that was disappointing, as you may have seen on newsletters from like the National Low Income Housing Coalition and others that take a kind of conservative view on some of the documentation requirements that I think will be more challenging, because we really are looking to streamline this as much as possible. I think that's the feedback all the states are giving, and we're working closely with our National Association of Housing Finance Agencies that is coordinating a lot of feedback and hopefully coordinating a lot of communication among the states on how we implement this and how we kind of together interpret the guidance from Treasury. It is very similar to how we've been running the DHAP program, with a couple of big differences. On eligibility, it's very similar. The federal maximum is 80% of area median income. The folks who have been impacted by COVID-19 in some way, with their employment or income or kind of other financial hardship related to the pandemic. One big difference is that it can fund prospective rent as well as arrears. There is not a maximum amount at the federal level. It's more a maximum months. So it can cover up to 12 months and up to another 3 months if the household still demonstrates need and there's still funding available. And it can cover arrears too. So it can be a mix of those. Someone who's 3 months behind can have those arrears brought up current and then get help for another at least 9 months. It does have some pretty strict deadlines, which is also a big topic of conversation and I think feedback. The earlier version of the bill that was released just before Christmas had a deadline at the end of 2022. The version that was passed and signed has a deadline of December 2021, which is not that far away. It sounds far away, but it's not. And with a benchmark deadline at the end of September 2021. And that's another thing where there's still guidance pending on exactly how that benchmark deadline in September will be interpreted and what that means. But it is on a short timeline. Next. So how we are getting there is we are taking a brief pause right now and have been seeking some feedback from folks who have used the program. We have had several kind of feedback sessions with property managers and owners. We had another 2 yesterday with a more general audience. Just trying to get some feedback about the program and its experience so far. It is a little difficult, like I said, to look forward, since there are some pieces that we really don't know kind of how how flexible we'll be able to be based on the federal guidelines. But as we are getting more of that information from Treasury and kind of assembling, what we're hearing from the folks who've been working with the program, we hope to be bringing that together in the next few weeks on a both big picture and smaller picture. I think there are some big picture things we're looking at, like the application process, who submits applications, how, what systems are used to review them, and things like that. And also smaller picture, more specific program policies that, either looking at things from the current version of DHAP that could be improved, or things that could be changed to reduce barriers. And some of those specific things can have a pretty big impact on how it actually works day to day. So going through both of those and really looking to have something relaunched as quickly as possible. But of course, we also want to make sure we're doing that responsibly and have something that can kind of handle the volume when it opens back up. In order to get kind of as much out as we can to Delaware households. I think depending on how we estimate, it depends kind of how much the maximum ends up being per household, how much you assume, each household, how many months they're using. But my estimate is should be enough funding for somewhere between 15 to 20,000 households. I think the deadline will play into that quite a bit, how some of that is interpreted and how much assistance folks actually end up needing over that time. But definitely there will be more to come. So I think the big message I want to share with folks is that there will be more rental assistance coming in the not too distant future. I don't have a date on it at the moment, but we are really, we hear the call of how urgent the need is and are trying to get that out as quickly as possible. And I think, is that my last slide? I can't remember. Oh yes, and mortgage assistance as well. Sorry, everything is so focused on the rental assistance right now. We also have been running the Delaware Emergency Mortgage Assistance Program since August. That is a longstanding program that was reformatted in August to kind of be more tailored to the current needs and also use some of the new funding that was available. The requirements have been pretty similar to DHAP around COVID-19 impact. It was also paused on December 30th. And as we have kind of this new information about funding sources that are available, kind of factoring in, which bucket can go for what, and how do we fill those buckets back up with the kind of new influx. The most recent relief bill does not include funding either specifically for mortgage assistance or that can be used for mortgage assistance. The new funding is very specific to emergency rental assistance. So we are looking at the different funding sources that we might be able to apply back to the DMAP program, and we do plan to reopen that as well. I think we similarly just needed to take a pause and look at the needs, how it had been working so far. I think on the area of mortgage assistance, we definitely are seeing more. There will likely be more need moving into the spring. So we were focused on getting some relief out as much as we could before the end of the year. But a lot of folks have been in forbearance for a year, and a lot of those will be starting to run out in March, April, May. So looking ahead to what those needs are and how that program might need to be tweaked as those change too. All right, that was the last one.
Thank you so much, Marlena, for the update on that. We're really looking forward to see how that program turns out once it starts to roll out. That is all we had today for our meeting. The next meeting is going to be April 21st, 2021. For any additional questions, you can contact me or our CoC program specialist, Felicia. We will both be available to make any connections that you guys need. All of today's materials and the recording will also be posted on our website, so everything will be available. Rachel or Carrie, if you had anything additional you'd like to say, go ahead, but that is it for the presentations. Okay, well, thank you everybody for coming out today. And I hope everybody enjoys the rest of their week. And go ahead and go watch the inauguration. Everybody have a great day.